Okay, I think we can get started. And if anyone joins, they could just hop in where we are. But thank you. We'll have a small, intimate group. Thank you for joining the City Health Dashboard virtual office hours. My name is Samantha Breslin. I'm the program supervisor here at the City Health Dashboard. And I'm really excited to be joined by Avalon Aragon, my colleague here at the dashboard, but also Stacy Montgomery, who's the Director of Research and Development at Crosswalk Labs, which has been a key partner who we've been working with over the past year or so to bring you the new data that we're going to talk about later in the presentation. So we're really excited to have Stacy join us today. These are meant to be very informal, interactive. If you have a question, you can either put it in the chat, or if you feel comfortable enough, please take yourself off mute, put your video on. Like I said, it's a pretty small group today, so we like being able to see people's faces, but if not, that's totally fine. And I will share my screen. Okay. And just a brief agenda. So we'll start off, with a bit of a dashboard introduction. For any folks who are new or maybe just need a refresher on who we are, we'll provide that. Then we'll do a little bit of a high-level overview on the recent data release that the dashboard had last week, one of our biggest data releases to date. Very exciting stuff. And then we'll go into a demo of the website where I'll take you through all of the different features and functionality. And then I will pass it off to Stacy to talk more about the CO2 metrics that we just added last week, as well as just overall the work that Crosswalk Labs does and does so well. So with that, we can start. So at the City Health Dashboard, our goal is to help cities across the US, cities with a population of 50,000 and larger, but really a growing number of smaller communities. We help them leverage the power of data to improve the health and well-being of everyone in their community. And if you are, Avalon, are you able to mute people just for the sake of the presentation? Okay, perfect. Thank you. And so we meet that goal by providing over 45 different measures of health, but also the factors that shape health and health equity for 1,200 US cities. As of last week, we have 1,200 US cities, and you can see the breadth of cities that we have nationwide. And like I said, we have any city that is a population of 50,000 and larger is automatically covered on our site, but we also have a growing number of smaller places. And we are a project that works out of the Department of Population Health at NYU Grossman School of Medicine. And we are an academic institution. So when we were building the site back in 2018 for our official launch, it was really important for us to get feedback and input from communities and city leaders themselves to help us make what we see as this easy to use, feature-rich one-stop shop for city leaders, for funders, for journalists, community organizations. And over the past 7 years, we have really relied on community and city level feedback to drive our strategy and help us improve and constantly upgrade what you see on the dashboard. And a note about our measure selection. So all of our data comes from national data sets. So places like the CDC Places Project or the American Community Survey, which is out of the census. And our data, one of the key tenets of our mission is to make sure that our data has the most rigorous methods of data collection. Like I said, we are a academic institution, so that rigor, we want to be able to stand behind the data that we provide. And all of our data is meant to reflect evolving public health priorities. So just because there's 45 measures now doesn't mean that number is set in stone. When we launched, I think we had 37 measures. So we've been adding over the past 7 years, we've taken away, as things have, not become as priority for cities. And we also want to make sure that our data is all amenable to a city level intervention. So if something is, maybe it's important, but you can't really move the needle at the city or the municipal level, we don't add that. We're not just adding data for data's sake. And all of our data is updated regularly, usually a minimum of once per year, and is balanced over 5 overarching domains, which you can see here. So there's a lot of information on this slide, a lot of different metric names, but you can see all of our measures broken out by our 5 domains, which is health outcomes, which are your traditional health metrics like diabetes or obesity, but also we place an equal emphasis on the 4 other categories. So social and economic factors, health behavior, physical environment, and clinical care. So that 360-degree view, that equal emphasis on the social determinants of health that we're seeing become more and more important as time goes on. And the measures listed here in navy are available at only the city level, whereas the measures listed in gold are available at both the city and the neighborhood level. So you can see that most of our measures are actually available at that more granular level. And then the metrics that have that people icon listed to the right also have demographic breakdown. So data disaggregated by either age, race and ethnicity, or sex as the data source provides that. And so how can you actually use the City Health Dashboard? What can you do with it? There's a whole bunch of different use cases of dashboard data that, we could spend the entire virtual office hours talking about different use cases. But the 3 big buckets that I see as being, the most salient for folks is 1, comparing health gaps across neighborhoods. With our maps and our visualizations, it's really easy to see how different neighborhoods compare across any of our metrics. So in this example here, you can see life expectancy by census tract or neighborhood in Columbus, Ohio, and see that these 3 neighborhoods, folks living in those neighborhoods have very different life expectancies. And these people live within a 2-mile radius, but what could be driving those disparities or those gaps? The dashboard's helpful for kind of starting those conversations and starting that thought process. You can use the dashboard to compare your city to cities in other regions or similar populations. So, cities that have a similar demographic or similar population size. And then finally, the dashboard is really useful for helping folks, regardless of where they work, really, to set priorities and better target scarce resources. And so a couple notes about our summer data release. So last week we had our annual summer data release. We always do, a big data release in the summer. And this one was one of our biggest yet. We added a whole bunch of new stuff, 122 new cities, 15 different metrics were updated to the most recent data available. We added 3 new metrics, which we'll talk about in more detail later. And we added 2 new features, one being redlining maps, which are many years in the making. We're really excited to have those on the dashboard. And another is better functionality for downloading the data. The City Health Dashboard is a free tool, so anyone that has an internet connection and access to a computer or a device of some sort, a smart device, can access all of the information and all of the features that the dashboard has. And we also have the ability for all users to download all of our data for free. So we made that a little bit easier for folks to do based on user feedback that we've gotten. And so let's dive into the dashboard. I'll just switch here to the website. So like I said, cityhealthdashboard.com, you're taken to this homepage. You just enter your city. I'm going to look at Grand Rapids today. Then what we call a metric selector kind of pops out at you, and this has all the different measures that I just showed on that previous slide, and you can dive into any of these metrics. They're all hot links, and it takes you to some more information about that metric. But if you don't know what you want to dive into, or you're looking for a more high-level overview, we also have this feature, which we call the city overview, which provides that that bird's eye view of how any city is performing across all of our different metrics and metric domains. So you can see that here. We can, click in, for example, children in poverty, and you can see some more information about the metric, how we measure it, the data source, as well as a thumbnail, which shows you the metric map. And you can click into the metric map or this button here to go into the metric detail. And we also have, I do just want to highlight a less used but really powerful feature of the dashboard, which is our demographic overview and demographic information. We provide really, really granular and disaggregated race and ethnicity data, not just by your 5 major racial ethnic groups. We actually go quite deeper than that. So you can see, for example, not only just what percentage of the city identifies as Asian, but you can dig even more into that to see what, do they identify as East Asian, Southeast Asian, South Asian? And so if we dig into Southeast Asian, again, we're seeing a list of even more disaggregated race ethnicity groups. So you can see not only do people identify as Southeast Asian, but they actually identify as Indonesian. And I see who identifies as Burmese or Cambodian. And you can also see quite granular breakdowns by age as well. And that data is available in tabular format, but also through maps. Everything on this dashboard, if it can be shown on a map, we will show it on a map. So you can look at here, for example, Asian. And as you click into different, the different filters for the map, you'll see some things change. And so you can see here, these greens represent the concentration of various racial ethnic groups. So the deeper the green, the more concentrated of that population lives in that neighborhood. So this neighborhood here, roughly, 17% of the residents in that neighborhood identify as Asian. But you can also go East Asian, and you'll see the map change again. And then perhaps we'll just look at Chinese residents, and you can see, in this neighborhood, 4% identify as Chinese, whereas this neighborhood also 4%, 2.5% in this neighborhood. And so this is really powerful information when you're thinking about outreaching into communities, or maybe you want to translate surveys or translate informative pamphlets, whatever it is. It's very useful to have this sort of information to help you be a bit more sensitive and a bit more nuanced when outreaching, communicating, and developing and implementing programs. So going back to the metric overview, the city overview, we can click into children in poverty, which takes you to what we call the metric detail page, which is the bread and butter of the City Health dashboard. So you can see, children in poverty in 2023 for roughly, I want to say over 95% of our measures, we have multi-year data available. And so when that's available, you'll be able to toggle across years here. And then we designed the site to be accessible for folks who are really data experts, but also folks who are a little bit more beginner in their data journey. And so we provide all of our data, both visually through things like the scale bar or the map, but we also provide it in plain language as well, because that might be an easier way that some people learn. So you can see here this scale bar, which represents the range of values for a particular metric in a particular city. And across all of our different metrics, lighter colors are always indicate better outcomes, whereas deeper colors, or this deeper blue, always indicates poorer outcomes across all of our measures. So for a metric like children in poverty, you're always going to want a lower number of your kids to be living in poverty. So these lower colors will be treated with these lower numbers will be treated with lighter colors. Whereas for a metric like high school completion, for example, you want more of your residents finishing high school or getting an equivalent degree. So the lighter colors would be on this side, at the higher side of the scale bar. This blue triangle tells you the average of the dashboard cities. It's not a national average, but it's pretty close. It's an average of the 1,200 cities that are on the dashboard. And then this gold bar here tells you the city or the census tract value. So in Grand Rapids, roughly 26% of their children are living in poverty in 2023, as compared to 17% across dashboard cities. And so looking here, you can see the map, the neighborhood level map of children in poverty for Grand Rapids. And each one of these census tracts represents a neighborhood. So you can see quite clearly, we have some pockets of higher poverty here and here and here. But what's interesting to me is that these pockets of poverty, you can see right next door to those neighborhoods are much better outcomes in all of these different cases. So you have in this neighborhood, 83% of kids living in poverty next to a neighborhood where only 2.5% of kids live in poverty. So what could be happening in those two neighborhoods that maybe they're not totally responsible for driving the gaps or driving the disparities, but it could help us start to uncover why. Is it, what's happening? Is there a historical context that we can maybe be thinking about or considering when looking at these two neighborhoods? And that brings me to this redlining map. So like I said, this is many years in the making, but our team just this past, last week, released the roughly, so 225 cities, give or take, were formally redlined back in the 30s, 40s, 50s. And those maps have all been digitized and put online. And so our team has downloaded those maps, but a lot of those maps, we provide those maps for, I want to say, 300 plus cities that are on the dashboard, because in places like Atlanta or LA, for example, what was once considered LA proper back in 1930 is actually 12 different cities, or I actually think it's 17 different cities in present day terms. So we have more redlining maps for our cities than was actually redlined back in the 30s. But for every city where those maps are available, users will be able to get more information on redlining for their city. And so by clicking onto that, that map feature, you'll see the redlining information turned on and the metric data turned off. And the default will be to see all redlined or all grades shown or kind of blown up. And then you can toggle each grade on and off to see only the grade A, only the grade B. And so you can see, where we're, in the neighborhoods that were redlined back in the 30s, what's happening to them in the present day. So this is a really cool mapping feature that we just added, again, based on a lot of user feedback. And so then going back to the children in poverty map, we can also, for around 1/3, but maybe a little bit more now, you can look at the data not only geographically, but also by race and ethnicity, age, or sex. So where that data is available, you will see it in this page on the site. So you can see, you can take that racial equity lens or that age equity lens to a lot of this information, or a lot of the metrics that we provide data on, and see, how are the different racial ethnic groups comparing to each other. Then one of the cool things that we provide, or that I think is cool or neat, and this is becoming more and more important for a lot of city leaders that I'm noticing when I have conversations with folks, is the ability to compare cities. So like I said, all of our data comes from national data sets, which allows you to, when you're looking at poverty levels in Grand Rapids, you want to be able to look at, you might want to look at what poverty looks like in Ohio, a neighboring state. But we need to know that we're looking at apples to apples. And so because we use national data sets, you can be sure that you're looking at the same you're looking at a challenge that is measured in the collected and measured in the same way. So you can enter your city here. Maybe I'll do Columbus, Ohio, and so you'll see that scale bar brought down below Grand Rapids. They have roughly the same poverty rate, or you can filter by various characteristics or criteria that matter to you and your work. So you can look at cities that have a population size that's the same as the city that you live in, maybe. And as you click more and more filtering criteria, the list of cities that match that criteria gets whittled down. So you're getting a better matching. So you can look at location. So perhaps you want to see adjacent states, and you'll see, Toledo, Madison, Wisconsin, Akron, Ohio. And again, as you click into those cities, those scale bars also will be brought up. And if I'm thinking about, okay, how can I improve poverty rates in Grand Rapids? Maybe I want to look to, what is Madison, Wisconsin doing? We know that they're in a similar location. We know that they have a similar population size. Are there policies or programs that they're working on that have been shown to move the needle in the right way? Is there someone that we could reach out to in that city to get more information? And then comparing metrics, a lot of the challenges that we provide data on, whether it's poverty or housing or education, are very large, complex challenges. They're not going to be solved by just looking at our website, and they're not going to be solved with one program or one policy. But we wanted users to be able to see how potential metrics might compare to each other, or how different challenges might compare to each other. So if we're looking at children in poverty, perhaps we want to see the percentage of which neighborhoods are struggling with food insecurity. So we have the ability to do that with this metric comparison, where you can see, in various neighborhoods, where, in these high poverty pockets, we're also seeing that folks are struggling to access food throughout the year. That's an expected pattern that we would see, but it's still sometimes good to check our assumptions and make sure that they're really grounded in data before we go to allocate resources or target a specific policy towards a specific neighborhood. And then we also provide the same data through scatter plots for folks who want to see those associations or correlations. And each one of these dots represents a different census tract or neighborhood. And you can click in to see the children in poverty measure or estimate, as well as the food insecurity estimate for that neighborhood. And then just quickly, I want to highlight impact stories. A lot of the questions that we get from folks is, how are other communities using this data? And we have this depository or repository of different use cases or case studies of different communities putting the data to action locally. And they're really quite, empowering and inspiring and helpful with thinking about how to take that next step and really use the data in your work or in your organization. So I highly recommend checking those out. And so just pivoting back to the presentation, let me swap the presenter view. We can go over in a little bit more detail all that was updated and added in the summer data release from last week. So like I said, we added 122 new cities. We add new cities for the last 3 or 4 years. We've done it every year. I don't want to commit to that, but typically when we add cities, it'll come in our summer data release. So we added 59 small cities. 37 of those cities were through the Put Us on the Map challenge. And I think we have a lot of Put Us on the Map winners on this webinar. So each year we have an initiative called the Put Us on the Map challenge, which invites folks from smaller cities to tell us why and how they would use data and why data is important for their community. And then we select them in the spring and then add those cities in the summer. And so we selected 37 cities through that challenge this year. I think we've added, I want to say, over 160 cities through that challenge since it launched in 2022. And you can see them all listed here on the right. We also added 21 designated places and 5 historically redlined places to also support those redlining maps that I just showed. Updated data. We are committed to trying to update our data at a minimum of one time per year. We have a couple measures, I want to say 3 measures that are updated on a monthly basis. So we release those metrics or new months of data for those metrics, I think twice a year. We do those in chunks, but most of our measures are updated at least once per year. And you can see all of those metrics here. These are metrics that come from, mostly come from the American Community Survey, which is out of the census. So as recent data as is available from the data source, we will update that accordingly. New features. So I mentioned the data download feature. We've gotten a lot of feedback. So being able to download data from our site has always been a feature that's been available on the website, but we've gotten a lot of feedback over the past 7 years that the process for doing so has not always been intuitive or as easy as it could be. So we have changed that. And so now users can come to the data access page, which is just cityhealthdashboard.com/data-access. And you're able to, it's free. You have to, the first time you come to that page, you have to fill out a data use agreement. But it's still free and you get access to the data immediately upon submission. But the way that you can download the data is you can, filter by the metrics that you want. You can filter by, the cities that you want to look at. You can look at one city, multiple cities. You can download track level data where that's available, if that's something that you're interested in. You can, like before, you only could download like the full dashboard city data set for every metric. And so now it's much more customizable based on your needs. So you can either download by metric or by city. So you can look at, in this case here with Middletown, Ohio, all of the metrics for Middletown, Ohio, or a select number of metrics for just Middletown, Ohio. And then the historic redlining maps. I'm not sure the level of familiarity with redlining on this call, but it's worth providing a little bit of an overview of what that is. So redlining refers to, it's the informal name of the practice of, grading financial risk of providing home loans based on various characteristics and locations of the neighborhood. And back in this was, a practice done by the Homeowners Loan Corporation back in the 30s, 40s, 50s. And generally the neighborhoods that were where low income folks lived, where immigrants lived, where racial minorities lived, were graded or were seen as less desirable or more risky for providing home loans. And these maps assigned each neighborhood with different letter grades. So A, which is seen, as colored in as green, was the safest investment, whereas D, which you can see colored in as red, was the highest risk investment. And the red, the red map color is how you get the term redlining. And like I said, this is available for 364 cities and accessible from the metric detail page on the map at the bottom right. And so the new metrics. The first metric that we added last week is a measure of food insecurity. And so this measures the percentage of adults who report that during the past year, at any point during the past year, they did not have enough food and did not have enough money to get more. The data is available for only 2022. But it is available at the city and the neighborhood level, so you can see a little bit more granular for that one. And our data source for this is the CDC Places project. And so that, a note about that is we only have data for 39 out of the 50 states. CDC Places does not include data for 11 states. And so we do not have data for the cities that are in those states, those 11 states. Then the next two measures, and I'm only going to go over these in a high level overview because we're going to hear from Stacy, who can talk more about them and how you can actually use these data in your work. And you guys are probably sick of hearing me at this point, but we have worked and partnered very, very closely with Crosswalk Labs, like I said, over the past year or so to bring these novel data to the site. But the first measure is CO2 emissions census tract average, which looks at the tract level emission of CO2 in metric tons throughout the year as averaged across the city, whereas the per capita measure looks at the average of total emissions citywide per person of CO2 throughout the year. The data is available from 2010 to 2024, so we have a lot of data available for cities on these two metrics. And what's really cool about these metrics and why they're so unique and innovative for our site is that we actually provide the percentage of the CO2 emissions that are driven from different sectors. So the transportation sector, residential buildings, electricity production, commercial buildings, and industrial buildings. And I'll get into how we present that in just a second, but this is the first time that we've been able to break down our data in this way so folks can see, okay, 50% of our emissions are coming from transportation. What do we have at our disposal? What levers of change do we have to help move the needle in the right direction when it comes to CO2? Obviously, we know climate change is becoming a bigger and bigger issue every year, every month it seems, and there are ways that government or organizations can step in to help mitigate the impacts of CO2 emissions and improve CO2 emissions. So you can see here for CO2 emissions per capita, which is a city level metric, all of the different sectors that are available. So you can look at, just all sectors, which just looks at the total CO2 emissions for a specific city. But you can toggle between each of the sectors and see here, we're looking at transportation, which is 40% of the CO2 emissions in Grand Rapids. And you can see that that Grand Rapids emitted an estimated 3 metric tons per capita of CO2 as compared to 3.7 metric tons across all of the dashboard cities. And then the census tract average looks at all of the different census tracts averaged throughout a city, as the name implies. So whereas the per capita metric is normalized per person, so you're able to look at you're able to compare New York to Columbus, Ohio, or to, a small city like New Britain, Connecticut, whereas here, you can't really do that because the New York City measure is always going to be so much higher than the New Britain, Connecticut measure. Again, the layout is pretty much the same. You're able to look at all the different sectors that we have data on. So you can look at the census tract average for all sectors, but then toggle between each of the different options that we have. So we look at here industrial buildings, which drives roughly 12% of Grand Rapids CO2 emissions and translates to roughly 3,739 metric tons of CO2 in 2022, as an example. And so with that, I want to pass it over to Stacy. Again, Stacy is the Director of Research and Development over at Crosswalk. And I'm really excited to hear, what she has to say about Crosswalk, but also how users of these data can actually put it into practice locally and not just see, numbers on the screen of like how a city is doing. So Stacy, you can take it away.
Hi, thank you for the introduction. Yeah, my name is Anastasia Montgomery. You can just call me Stacy. I'm the Director of Research and Development at Crosswalk Labs. Um, Previously, I was at Northwestern University, so I was using satellites, observations, models in order to figure out, um, in order to develop these really high resolution maps of air pollution over Chicago in particular, but the Great Lakes region in general. And that work really builds on what I'm doing here at Crosswalk Labs. I help lead the team of scientists and engineers that we have to develop a carbon emissions model, and some other products that help empower decision makers to make every decision a climate decision. I think Samantha's overview of like the 7-year initiative that the City Health Dashboard has been really building upon, in order to do this kind of data delivery is such a challenge, as well as like the work that we're doing at Crosswalk Labs. It's coming from over 20 years of academic research, but in particular, like climate scientists have been developing these CO2 emissions models so that we can better estimate climate impacts and do work with these chemical transport models. So figure out where and how much pollution is moving around. And we at Crosswalk Labs have basically developed off of that academic research and then made the emissions data actually possible so that people, cities, companies can actually identify where and how much carbon emissions is coming from where, what, whatever. And in particular, really addressing that granularity. And our emissions product is available through the City Health Dashboard. One part that's cool is you can actually check out emissions from 2010 through 2024. Looking at the per capita tract average, there's actually a map associated with it. But yeah, at Crosswalk, we focus really on developing carbon emissions inventories for a variety of customers. So if you want to go next slide. Yeah, we've already looked at this map from Samantha earlier, but just to once again go over it, you can click on that 2024 and that'll bring you to other years so you can actually kind of see how your emissions change over time. This is just the per capita product, so that means the total CO2 emissions over the city divided by the total population of the city. And that's really helpful just to see like how emissions have changed over time. And then you can also cut that data into different kinds of sectors. So like how have commercial buildings changed relative to transportation emissions over time? And then if you look at the actual tract level emissions, uh, I don't have the screenshot in this, but there is the ability to look at like the map and compare census tracts to each other. And I'll speak really briefly about how we actually developed this data. So this output is from a bottom-up emissions model. So that basically means that we do things like aggregate vehicle traffic emissions, figure out what kinds of cars are on the road, how many cars are on the road, and then estimate CO2 emissions from the kind of traffic that's happening on the road. So that's an example of how we develop our on-road traffic emissions. For some kinds of data, we actually have actual observation or actual measurements of the emissions. So we pull in EPA data, and the EPA requires large emitting point sources. So just think of like industrial facilities, these kind of steel production plants. They're required to measure how much chemicals the chemical flux, sorry, really technical there, but how much chemicals is coming out of their stacks, and then we actually can get a real measurement at the point of how much CO2 is coming from that. And then for other sectors, we do other kinds of transformations of an activity. So for example, vehicles on the road, and then convert it to CO2. So we're coming from an academic place where this is how these kind of climate models operate, and instead we package it in a way that can be easily consumed by a decision maker or and easily look at what happens over time, what happens over space. And yeah, we break it out for the NYU dashboard for the commercial buildings, electricity production, industrial, residential, and transportation emissions. Yeah, we can go to the next slide. So the two things that I'm going to talk to y'all about today is specifically how our data has been used to secure grant funding, as well as how our data has been used to basically investigate local, like uh, local, not to say like local complaints, essentially about what is happening in the cities, because you actually can, compared to other kinds of data sets, which can be really coarse, maybe at a city or a county or a state level, if that's the best kind of emissions data that you have, and you're a small city, or you're just trying to isolate a specific neighborhood, it's really difficult to identify from like these really coarse trends what's specifically happening in your area of interest. So one example of how our data has helped this is we worked with some cities, counties, and states in order to apply for the climate pollution reduction grants. So this was actually a really kind of lucky serendipitous fit for the kind of work that we're doing. So the Inflation Reduction Act, the IRA from the EPA, had an infrastructural component that basically told different kinds of jurisdictions, whether it be like cities or groups of cities or counties or states, that they could get some infrastructure funding. But one of the first barriers to securing that funding was that they needed to have a carbon emissions inventory. Typically, these kinds of emission inventories, if you work with like a consultancy or an outside agency, these can cost thousands of dollars that like local planning agencies might not have in the budget. So we worked mainly with an organization called Climate Mayors, which is a group of cities that have pledged to be zero carbon or work on their climate plans, and basically develop the functionality that you can just download your emissions inventory, so you could get your scope 1 and scope 2 emissions, so both your scope 1 direct emissions, scope 2 purchased emissions, and actually start applying for these grants. And this is a really nice and easy way for you to immediately see, for step 1, be able to apply for this grant, and then step 2, you can apply for implementation grants, which basically means that you must show how your action that you're securing the funding for will change the emissions. And it can be really helpful for actually planning, because you can look at, for example, transportation accounts for 40% of our emissions. If we target transportation, that's going to be likely the most amount of reduction that we see. And this kind of funding can be used for things like electric vehicle charging. So this is another example that if you go to the next slide, we worked with Climate Mayors and kind of did a data blending. So once again, something that's pretty relevant for this dashboard initiative is that typically just using one data set isn't really enough to understand what's happening. You want to be able to layer with like not only where is pollution highest, but who is in most need. And for example, in this case, we worked with Climate Mayors in order to both identify where electric vehicle chargers are, but also identify the areas that were highlighted in the Environmental Justice Index set out by the EPA. But these would be areas of need where they both have experience high pollution and uh, are in a disenfranchised community. And then basically, like, how far away is it for these people to access electric vehicles so that we can distribute vehicle charging in an equitable way that actually can be both data driven and consider multiple kinds of indices that you're trying to maximize for. So rolling out electric vehicle chargers that will address high transportation emissions in a way that's equitable. And I spoke with some of our clients about what was useful in terms of our data processing and using this kind of data in order to apply for grant funding. And they found that it's really useful that Every year, the data is the same. Also, our method is consistent across the US, so no two cities are treated differently. We have a national and consistent methodology. So when you do compare different cities, they'll have the same assumptions and methodology applied, which can be really helpful. Um, Also, being able to link this to other data sets allows for you to have kind of like a band of reality, like an understood amount. Like this is modeled data. However, and depending on the assumptions, you can get different kinds of outcomes, but we allow for that easy linkages and, are happy to combine multiple data sets so that people can be very comfortable about the kind of decisions that they're making. And most importantly, and by far the most useful aspect about our data is that by having this kind of spatially disaggregated information, so as opposed to just collapsing something like mortality to a county level, and then the pollution to a county level, you can actually begin to identify like specific, like for example, cancer clusters or hotspots that are associated with both pollution and these negative health outcomes. So if you think about trying to set up a policy or make a decision or roll out an initiative, being able to layer multiple kinds of data sets can really benefit with that. So yeah, in general, it was really fortuitous that we both had the IRA and the requirement for an emissions inventory in order to secure that funding. But I think a lot of times if there's a barrier to access by just saying that we just don't even understand where pollution is at a finer resolution, we have to use either a county level data or state level data. By using our data, we can actually help these cities make more specific and actionable policies, because sometimes you might find that in your county, you might have a power plant that's maybe inside of your city or outside of your city, and that can hugely shift the way that your city is actually, like the way that you're actually going to quantify those emissions. Like you can't just population downscale a county level emission if there's like one of these huge point sources in or outside of the bounds. Yeah. And kind of on that note, we can go to the next thing. So this is a kind of project that I'll highlight that we at Crosswalk worked with John Lippert, who does reporting for the Chicago Tribune. And we were working with John, and John is really interested in Chicago and Great Lakes region emissions. And he was clicking through our website, which I think we have a link in the chat. But this data is also available through the NYU dashboard. Just a slightly different view. This one was a little bit more tailored for the actual policymakers and the cities. So what we have here is a comparison of East Chicago and Chicago. And basically like that green area highlighted, that's a super small area right next to Chicago, is a city in Indiana that has almost the same amount of emissions as the entire city of Chicago, which you can see highlighted to the left of it. Also, like the fact that Chicago is right on the border of Indiana, I think that's also important to note. If you think about like the state of Illinois versus the state of Indiana, a lot of times when there are kind of environmental laws and the way the EPA is set up, you typically get, for example, a fine associated with a specific state, even though obviously interstate transport and the way that things are really closely aligned, can really influence the way that like the region's pollution is going. So here we worked with John. He thought it was really interesting. And then if you go to the next slide, when you divide by per capita emissions, what you end up seeing is Chicago is that blue line. It looks almost zero. It's not. It's around 6, which is closer to the average. And then you look at divided by East Chicago, we've got like 400. It's almost 100 times larger in per capita emissions in East Chicago. And at first, John was like, "Was this an issue? Was there a mistake?" And the answer is no. Actually, what's happening here is that when you look at this region, there's a huge amount of actual industrial emissions happening. So if you click to the next slide, here's some images from the article that John wrote up for us, or John wrote up using our data, what we see is on the top right, that is an airport, O'Hare Airport, which is one of the largest single points of pollution within the city of Chicago limits. But then in the lower next three photos, yeah, we've got two steel refineries as well as an oil refinery. And in particular, in Indiana, Indiana processes about a quarter of the nation's steel. And a lot of that processing is happening right at the edge of Lake Michigan, right near the border of Chicago. So if you click on the next slide, basically, oh, I guess not. Sorry, forgot the last slide. Basically, we made up a map of the largest point sources, and what you see is that these facilities really are the thing that are contributing to the outsized pollution that we're seeing in places like East Whiting, Indiana, in Gary, Indiana. Just these really large industrial point sources near Indiana result in these very small areas having equal, if not more, emissions than the city of Chicago. And then the per capita emissions as a result really kind of being skewed. And that actual per capita indicator was just showing how much like a small town with a steel production facility results in really high normalized emissions. And it was a really interesting study because this data, in particular, this point data is available through the EPA. These facilities are required to disclose how much emissions they are reporting, but just having the kind of clean and easy access to the data really made it clear and really highlighted the way that these large point facilities can skew the emissions of a town or the region really. And then you can link it back. And John used this data to support the reporting of like the kind of community complaints on the ground associated with these kinds of facilities. And this has been pretty well known in the Chicago area, but continuing to have that data easily accessible and support what the neighborhood is saying was a really useful and interesting initiative. So yeah, that's it for me on my 2 points. I'll pass it over to Samantha again.
Thank you, Stacy. Wow, that was so fascinating. Thank you for sharing. And it just, it you make it, you really, drive the point home that, with these things, like with these sorts of data, like you can't look at them alone. Like the data that you guys provide is so powerful, but that power is magnified when you compare it to, like poverty, or you compare it to cancer clusters or health outcomes, and you're really able to do so much more and learn so much more when you could layer data sets. And that's something that's really important to our users as well, and something that we're always thinking about. How can we help people do that layering and help them, make that process a little bit easier? And so along those lines of making things easier, I want to spend, I know we only have a couple more moments, but I did see a couple questions in the chat that I want to go through as we have time. And so the first comes from Mark, who says or asks, how/where do you find data at the neighborhood level? And does neighborhood equal census tract for this dashboard? Yes. To that second question, yes, we use neighborhood and census tract interchangeably, but when we say neighborhood, we mean census tract level. And then in terms of where you find the data at the neighborhood level, for the metrics where that's available, which is roughly, I want to say maybe 80% of our metrics, once you go to the metric, you'll just see it. And for the measures where you only see a city level map, that means we don't have that level of granularity available, but it'll be available for you on default where it is available. Then we have a question from Liz. Hello, Liz. It's great to see you. It looks like, oh, I answered the question, but just in case someone didn't hear it, you asked why the food insecurity measure wasn't available for a number of dashboard cities, and you checked for a couple cities in Virginia. And that is because CDC Places does not actually present any or provide any data for 11 different states, including Virginia. I know New York is one of those cities. I can't remember the other 9. So for any city that is in those 11 states, you will see like a data is not available for this city for that metric. I think that's the only questions that were thrown in the chat, but if anyone wants to take themselves off mute, we are here to answer anything. And if none, that's totally fine too. And thank you, Avalon, for putting those links in the chat as well throughout the presentation.
Tammy, I was just going to ask if this is recorded
Yeah.
because I'd love to send this to some of our colleagues.
Yes, it is recorded, and we can send it along after this call to everyone who was registered. But we also have all of the virtual office hours on our YouTube page, which we can put in the chat as well. I think it's just City Health Dashboard. But we do make all the virtual office hours available through YouTube. Any other questions? Well, if none, Stacy, do you have anything else? I feel like, do you look like, you know, you're good? You look like you were trying to take yourself off mute. Do you want to, Stacy, if anyone has any questions about Crosswalk, do you want to maybe put your info in the chat?
Yeah.
Would that be okay if anyone reached out?
Yes, of course.
Awesome. Well, thank you all for joining this session, and thank you, Stacy, for presenting with us and partnering with us. If anyone has any questions for us for the City Health Dashboard, you can also reach us at the links that Avalon shared, but I'll also put my own details in the chat. We are here for anything, any of your needs. We are here, and we can help or at least point you in the right direction. So thank you again for joining us, and we will see you in September for our next session. Thank you.